Hi, my name is Elise Anna Harris, three-time triple negative breast cancer survivor. I'm here sharing my experience, praying, hoping, encouraging those who are currently going through treatment or who have previously had breast cancer treatment. Today's topic, it is protecting yourself against family and friends. And I pray that you all had a great Mother's Day and wanted to start the topic off again, protecting yourself against your family and friends against chemo exposure. Chemo, for those who don't know, it is a series of drugs that is used to treat those who have had cancer or they currently do have cancer, and there's a combination of drugs that is used to fight the disease. And if you're living with someone or you're helping with someone that is living with someone or family or friends that has cancer and that you're helping them with their care, here are some steps you will want to follow. And one of the sources that I referred to was the MD Anderson Cancer Center. Um, Usually, pretty much most of the time, I get my resources from reliable sources such as Susan G. Komen, the American Cancer Society. That's just a couple of them. So the sources, and plus by me having experience, that helps to know that the information I'm presenting to you is reliable. Also, too, before you're even given chemo, there's a port that you would have to have installed. And I'm going to show you right here. This is where the chemo port was installed. You have to go to a hospital and they'll give you anesthesia for the area. I felt the entire thing, even though they gave localized anesthesia. I still felt all of it, and it's very painful. But considering the alternative, the first time I had chemo, it was given through an IV, and compared to the chemo that I had to take 7 years ago, the cancer was more aggressive than the first time I've had chemo. So therefore, I had to get a port because my veins would not be able to take the chemo, and I had 6 rounds of chemo. So I just wanted to give you some steps here to share with those family and friends, and for those who currently may be going through chemo. All right. Again, like I said, that was the port here that was installed right here. And here are some steps you want to follow so you can limit your exposure to chemo. Do not eat raw meat or seafood. Definitely don't want to do that because your stomach, when you've had chemo, and now they have the anti-nausea medicine, which, thank God, that helps a lot. When my mother had chemo, the chemo that she had, I would always see her when she would have chemo. She would come home and said it felt like she sucked on a penny. I would see her throw up, and it would just make me sad. But folks, please, talking from personal experience here, you do not want to eat anything raw, meat or seafood. Avoid foods that may advance, that may aggravate the chemo. You can always check with the oncologist as far as foods, and I'm sure they'll tell you, perhaps give you some material that you can read so that you can avoid that. Don't start taking any new medications or any supplements. Check with your oncology doctor first. Again, do not take any new medications or supplements when you're going through chemo. When you're going through chemo, it takes everything out of you. Again, trust me from personal experience, it takes everything out of you. And you don't want to try something new without letting your oncologist know. You don't want to interfering with their treatment at all. You do not want to drink or smoke alcohol. This is my experience. Um, I've seen people, and it depends on some treatments are really aggressive. And then again, the cancer is really aggressive, and you have to be proactive about it, doing everything that you can. And chemo, like I said, it takes everything out of you, takes all of your strength. Also, you want to avoid exposure to the sun. Limit your exposure. Wear protective clothing, a SPF 30, 30 sunscreen. Again, check with your oncologist. Don't risk pregnancy or chemo. If you're currently sexually active, you want to limit your exposure. You want to use protection. Definitely won't want to use protection if you're sexually active during chemo. Use protection. Again, check with your oncology doctor. Caregivers, family, friends should take precaution when they're doing your laundry, because especially if you're throwing up, you don't want that the vomiting, the germs, to be exposed to that. Again, you just want to keep those clothes in a separate area. Um, Wash them separately from other clothes because you don't want that exposure. Do not socialize with sick people, people that have colds, because that will limit your immune fight. When you are having chemo, your white blood cells tend to go down, which means that you're open to infection easily. Trust me on that from experience. You don't want to be around anybody that's sick. Stay clear of them. And if you have family friends that are coming over with that are sick, I would suggest you do not do that, because you don't want to stop your therapy, your chemotherapy. You want to keep it going. You want to hurry up and get it over with. Avoid trying to do too much. Personally, from that last chemo I had, it wore me out. I was working while I was going through chemo part time. When I take it, the day after I take chemo, I feel like I was on like 100%. About a few days later, I felt like I could barely get out of bed. I didn't want to go to work. I didn't want to eat. I didn't want to do anything. So please, if you know those who are currently going through, please don't let them do too much to overdo them, because they get easily tired. And if you have family or friends, you have questions, please don't write your questions down. Have your speak with your oncology doctor. Have your family and friends. When you do have a visit, have someone go with you with your visit. Write your questions down before you go. Again, here, when you're washing clothes, they should be kept separately. You do not want to expose those clothes with others because of the bacteria, especially if you're throwing up. And if you're vomiting a lot, again, check with your oncologist. There's something they give you when you're taking chemo. And trust me again on that, the anti-nausea medicine, it does help a lot. Thank God I did not throw up at all. But like I said, there are times when I took that chemo, and I took all my strength. When you're using a bathroom, the toilet, when you're defecating, make sure you flush the toilet and close the lid, because you don't want that exposure. While I was going through chemo, there was a lot of night sweats. I have a fan by my bed, so I turn the fan on and off to keep me cool. Those hot flashes. 1 minute I'm hot, next minute I'm cold. So, like I say, I have the fan by my bed. And when you have those night sweats during chemo, you want to make sure you keep clean linen on your bed, wash your sheets thoroughly, get you some type of disinfectant. Again, you want to make sure that you have clean linen on your bed. Do not, and trust me on this one, do not eat any fried foods, candy, or pop while you're doing chemo. That is not a good combination. I've done that. Again, trust me on that. You don't want to eat any fried foods, candy, or pop. Again, you can check with your oncology doctor to find out like the foods that you should eat. Primarily vegetables, broth. I know broth is not a favorite, but when you can't keep anything down in your stomach and you're going to lose weight um, when you're doing chemo because you're not going to have an appetite to eat or drink. You may want to consider making smoothies when those times when you can't eat. Um, uh, Smoothies like that contain vegetables, you can make them yourself. Again, you want to check with your doctor on that. Again, name is Elise Anna Harris, here sharing my experience, praying, hoping, encouraging those who are currently going through. I wanted to share my experience. I pray that you can share this video, and I pray you should share it with others who are currently going through. Thank you for listening to me, for letting me share my journey. Thank you for subscribing. God bless you. Until next time, peace.